This is my presentation for case study 3. My intervention is token economy, and my name is Heather Sims. The token economy is a behavioral-based intervention that utilizes reinforcement and exchange of a medium to earn or purchase goods, services, or privileges. The token economy is an evidence-based practice by Simonsons et al. 2008, as well as an established psychological procedure by the American Association Task Force on Promotion and Decimation of Psychological Procedures, which is the highest rating obtainable. So just as a refresher from my previous UK studies, my target behavior was elopement. The probable function was escape/access to tangibles. Elopement was defined as any instance where the client leaves the designated area without given permission to do so, / by being accompanied by an adult. In my next part here, I just have the examples / non-examples. And then my intervention again is token economy. And then in this instance, the replacement behavior is going to be waiting, and they're going to be reinforced for waiting behavior with a token. Once 3 tokens are received, they can be given access to the desired reinforcement, and the durations of required waiting will change dependent on where the client is in baseline and then intervention, and the waiting will be defined as any instance in which the client is staying in the current assigned area. An example would be waiting to earn 3 tokens before running to a toy. A non-example would be running to a toy without earning their 3 tokens. So how to train staff. I had a resource from the Supervisor's Guidebook, and this highlights protocol that should be followed to train staff. So step 1 involves describing the skills needed to be trained, which in this case would be to decrease the elopement, increase the waiting, and to implement the token economy. The step 2 highlights the importance of providing the trainee with a written summary of the skills that need to be trained. Step 3 would involve modeling what implementing a token economy would look like, as well as examples of the reinforcement that can be used for absence of the elopement behavior and presence of the waiting behavior. Step 4 is really important because it's allowing the staff to then practice what you've shown them. So implementing the token economy, providing feedback is super imperative at this stage 2. It's best to provide positive feedback to begin your feedback with a positive note, add your constructive criticism, and then again end with that positive feedback. So one way you can do this is, I like how you condition that token as a reinforcer, but next time try doing it quicker for the learner. Again, great job. Then step 5 places the importance on repeating step 4 until competence is demonstrated, which ensures that implementation will be done successfully. This slide is in regard to treatment integrity. So as highlighted by Falakfasar et al. 2021, treatment integrity is the extent in which procedures are implemented in a way that is consistent with provided protocols. Treatment integrity is important due to its ability to aid in making accurate conclusions regarding the functional relationships between the independent and dependent variables. The process in which you implement the token economy is going to be listed on this slide. Staff should indicate why for it happening and for it not happening. So why and N, yes and no. So here's the first step. It's to operationally define the target behavior, which we established was waiting. And then we've got step 2 here, which is to condition the tokens as reinforcers. Then step 3 is to select the backup reinforcers to be purchased in exchange for those tokens. Our next step is to select the token reinforcement schedule, the required amount of responses to receive those tokens. And then the next step is to select the response requirement / the environmental conditions needed to exchange those tokens. The next step is to select a cost of that backup reinforcer using those tokens. And then this would be the last step of you're implementing the token economy. So staff should be able to indicate a why for each step to proceed with intervention past practicing with their supervisor. In the event that they are unable to successfully implement all these components, they need to recognize with their supervisor what they missed and continue practicing until competency is demonstrated. Social validity of token economies. Carr et al. 1999 explains that social validity is the degree that behavior change efforts impact favorably upon consumers. Social validity can be evaluated by different methods, such as having direct care staff or parents fill out questionnaires, as well as comparing the treatment outcomes with established behavioral norms. In this instance, the target behavior for reduction is elopement, which can be a very dangerous behavior due to individuals possibly getting lost or walking into situations that could be potentially harmful. Carr et al. Highlights that the token economies are a common reinforcement-based behavior procedure. The token economy's emphasis on reinforcement help contribute to its favorable impact that it has on individuals. In this case, I've made up a questionnaire using a Likert scale to evaluate the social validity of this intervention, which is something we could use in the future. So here I just have the questions and then I have the rating scale. Some of the questions include the target behavior selected for reduction was socially significant to client and stakeholders. The token economy relied strongly on reinforcement procedures. The token economy protocol was explained in detail. The token economy reduced the target behavior. And I am overall satisfied with the token economy's implementation and outcome. These questions are simple, they're direct, and the answers will have meaningful impact on how we can proceed in the future with implementing the token economy. So here is my BACB task list integration to explain like the treatment integrity and the validity relevant to the task list that you can see. So for H, selecting and implementing interventions, H4, when a target behavior is to be decreased, selected acceptable alternative behavior to be established or increased. So the target behavior here selected for decrease would be elopement. The acceptable behavior we decided would then be the alternative behavior of waiting. Then we've got H6, which is monitor client's progress and treatment integrity. So the use of the treatment integrity checklist that I created in the previous slide can work to ensure that the critical components of the token economy are being implemented, which ensures optimal effects are produced by this intervention. Then we have the personal supervision and management, where I4 is to train personnel to competently perform assessment and intervention procedures, as highlighted by the protocol used to train staff. Step 5 requires practice implementing intervention until the staff demonstrate competence in doing so. Staff should check off each step of the token economy checklist. As established before, if a staff misses a step, they should communicate with the supervisor which step they missed and proceed with practicing until they are able to get it right and all steps have been checked. And then for I4, which is the use of performance monitoring, feedback, and reinforcement systems. So this can be seen in step 4 of that staff training protocol, which requires feedback to be given. This should, again, include that positive feedback in the beginning also have that constructive feedback in there, and again, end with that positive feedback. So these are some ways you can see the task list integration in this case study. The following are my references used to create this case study 3 presentation. Thank you for watching and have an excellent day.